Good afternoon, everyone. Right, we have got a few more people that are due to join, but just conscious of time, I will kick off and then we can obviously get into the main presentations. So good afternoon, everyone. My name is Rachel Dixon, and welcome to this month's Innovation Club, where we'll be discussing how creative arts-based healthcare interventions can improve patient outcomes for children. So it's great to have not only NHS colleagues on the call, but also innovation pop-up members, as well as partners from the wider health innovation ecosystem. So a little bit about me. I'm a business development and innovation manager here at the Innovation Pop-up in Leeds, at the Leeds Teaching Hospitals, which is also part of the wider R&I team. So the Innovation Pop-up is a membership organisation, and we're currently working with around 50 companies. And I lead on the programme of activities for members at the pop-up, which is designed to engage our colleagues at the Trust to embed a culture of innovation here at Leeds, as well as industry as well. So we are based on site at the LGI. So you get, you're part of a vibrant healthcare community based in the hospital. We're embedded in a strong health ecosystem, and all the staff and the NHS networks, academia and industry partners. And we offer our hands-on learning, so things like educational sessions and these networking events that we run in person and online as well. And finally, we offer that visibility and credibility, so we can leverage our major teaching hospital network to build trust, recognition, and impact. So without further ado, a little bit of housekeeping and then we'll move on to the agenda and I'll introduce the speakers. So this session is being recorded. Would like to make it as interactive as we can. So if you can, I know it's not always possible, please pop your cameras on, but please do stay mute during the presentations. If you've got any questions that you can think of throughout the presentations, please pop them in the chat. We have allocated a little bit of time at the end for a Q&A, and any questions that we don't get through, we will collate them and we will follow up with an email as well. You will hopefully have the opportunity to come off mute at the end as well if you've got any questions that you'd like to ask any of the speakers. So today's agenda, we've got Steph from CHORAL, who'll be presenting. We've got Persephone from CAHREL, and then we've got Alex from Smileyscope. I'm not going to say too much more because I'm conscious that they're going to introduce themselves and I don't want to steal their thunder. So with that, Steph, can I hand over to you, please? Thank you.
Absolutely, thank you. I'll just get my talk up. Hopefully that's working.
Yeah.
So, hi everyone, my name is Steph Roberts. I am the Programme Manager for Child Health Outcomes Research at Leeds, which is also known as CHORAL for short. Thanks very much for the invitation to talk today. So I'm just going to give, there we go, a quick overview of our programme. So CHORAL's funded by Leeds Hospitals Charity, the University of Leeds and Leeds Teaching Hospitals NHS Trust. It really came about because our director noted that there was loads of amazing child health research that was happening, but nobody really knew about it. So CHORAL was developed to really kind of build that visibility and develop the connections and community within child health research. So we're investing heavily in training. So we've got a pipeline development of new researchers. We have a fellowship scheme. We've got a number of posts that we're also recruiting to. And we really want to build and become a centre of excellence for child health research and really put Leeds on the map. So we've got quite a few different themes within CHORAL. I don't really have time to go into them all in great detail today. So I'm just going to give a really quick overview. So transforming outcomes through data linkage. This is really linking data and interrogating data to identify and understand the inequalities that are facing children and young people, and develop integrated care plans as well to improve outcomes. Children's cancer translational research is using innovative science to identify kinder new treatments for children's cancers. So we know that children's cancer are biologically different to adult cancers, and yet children are quite often treated with chemotherapies that are developed for adults. So using age and tumour matched preclinical models can really allow kinder treatments for children and young people. Improving childhood wellbeing has largely focused on educational attainment and special educational needs so far. We're part of a Child of the North campaign that I'll come on to in a second, but we're also looking to really align with the children's hospitals and identify and address shared challenges as well going forwards. We've recently appointed a new clinical professor, Professor John Dorling, who's brought with him neonatal clinical care research theme. So he's really interested in identifying challenges faced for premature and severely ill newborns as well, and also improve the outcomes for those that are most at risk. In children's oral health, we're designing, evaluating, and implementing evidence-based approaches to improve children's oral health. And I've already mentioned our fellowship scheme and prizes, but we're really invested in future leaders of child health research as well. So we're developing a community, and we've also got mentoring and supervision and peer support community as well to really invest in the future. So while CHORAL's core mission isn't centred around arts-based interventions, our work is deeply intersected with creativity co-design and improving children's wellbeing and experiences of healthcare. So I'm just going to talk about a few examples of the work that's aligning in this space. Sorry, excuse me. So through work of Professor Mark Mon-Williams and various researchers in Leeds, and collaborations across the N8 Research Partnership, we've been involved in a campaign for a country that works for all children and young people. So this campaign has produced 12 reports that addresses key challenges that are faced for children and young people today. And one of those reports was around developing an inclusive culture through art and creativity. So this report highlighted the unique ability for creativity to re-engage students who have disengaged in school. An analysis of the connected Bradford dataset showed that disengaged students were 3 times more likely to fall into the NEET category. So that's not in education, employment, or training. So from this report, 3 toolkits were developed to help sectors implement interventions, and highlighted here are the recommendations for child health practitioners. So this really demonstrates the importance and need for creativity in improving outcomes for young people. I also wanted to highlight a project from Claudia Heggie. So this is part of her NHR doctoral fellowship. So we know that 8 in 10 children undergoing chemotherapy will develop painful mouth ulcers called mucositis. So this is preventable with a simple light therapy called photobiomodulation, and it's recommended in guidelines, but it's actually poorly implemented. So part of Claudia's work, she's identifying the barriers to improve uptake and availability of this therapy for children and young people. So Claudia's used creative methods to really understand what mucositis means to children and young people and the impact that it has. You can see here on the screen one of her patient and public involvement groups that she had with children and young people to develop models of mucositis. And she's also co-developed a video, which is now hosted on Leeds Children's Hospital's TV, which really explains what children and their families would expect from receiving photobiomodulation treatment to really improve the uptake and understanding of the treatment that's available to them. Similarly, Stephen Morris, he's undergoing an NHR doctoral training fellowship at the moment as well. And his project is called MiniMeds. So this is minimising the risk of harm from administering medicines at home. So this is really to help kind of like decrease the anxiety and the risk of harm from administering medicines, and building confidence as well for parents and caregivers. So Stephen's co-developed a practical guidance with his families and contributors. And what's really exciting is that he's currently developing a game. So this game is for healthcare professionals to play with families and children to really spark conversations and identify any barriers that they might have or any risks. So, for example, a child might refuse to have their medicine, or they might have time constraints or run out of medication or receive conflicting information. And it's really to kind of like signpost them into information that can really help them and reduce the risks and build confidence within families as well. So I just want a final word on community. So community is really important for us in terms of networking and linking people up and really driving excellence in research. So we run our own choral gathering series, but we also support the Children's Research Forum, which is an excellent network of early career researchers, and also the Paediatric Grand Round. We have our own newsletters as well with opportunities funding, and also just celebrating joint successes as well within Leeds. So please do sign up to our newsletter, or if you've got any questions, please also feel free to drop us a line. This is our core leadership team. So our director, Professor Adam Glazer, our deputy director, Professor Richard Feldbauer, and our core theme leads as well. Unfortunately, I can't put everyone on it, otherwise everyone would be really tiny. But yeah, if you've got any questions, please do not hesitate to get in touch. We'd love to hear from you. Thank you very much.
Perfect. Thank you, Stephanie. And I appreciate you haven't got much time there. So I would highly recommend everyone to sign up to the newsletter, and we can share contact details afterwards if you want to follow up with Steph. But no, that were really useful to hear all about CHORAL and some great case studies there. So thank you for sharing. So with that, we'll now move on to Persephone, who's our keynote speaker for today. So Persephone, over to you.
Good afternoon, everyone, and thank you very much for the invitation. My name is Persephone Sextou. I am a professor in applied theatre for health and well-being at Leeds Beckett University, just around the corner from Steph, and the director of the Creative Arts and Health Research Lab known as CAHREL. I will share my presentation now. It's coming up. Can we all see it? Yes.
Yeah.
Brilliant. Okay, so the title of my speech is Once Upon a Hospital World. That links really nicely with stories. And I will also talk about creative arts-based healthcare interventions, improving outcomes for children and families in NHS. Arts-based participatory research happens within communities, and the examples that Steph just gave us are amazing. So it was a very good introduction for some of the things I would like to say today. In arts-based research, we want to believe that we think outside the box. We bring inclusive and meaningful artistic ways of knowing in scientific investigations and clinical trials. Arts-based research applies to medical fields and informed clinical research. They develop the arts for health topics and vulnerable audiences. We build partnerships with external organizations. We capture children and families' lived experiences and understandings. We try to give voice to their views in an inclusive environment within the protection of the fictional context and the aesthetic distance that the arts can create. We translate any negative clinical experiences to positive artistic expressions and try to minimize traumatic experiences when children come to hospitals. And we want to believe that we speak meaningfully to the participants' minds, effectively improving their hospital experience. You might be familiar with the painting of the Catalan painter Joan Miró. These are two of his paintings. I use them as a metaphor. On the top painting, the blue dot is the clinical researchers and the NHS working from within the healthcare system. And on the bottom picture, again by Miró, the red dot, in my metaphor, symbolizes the artists, the creatives who sit outside the healthcare system. So the marriage of the two is a wonderful challenge, but it does work. And today I'm going to give you some examples. In the Creative Arts and Health Research Lab at Leeds Beckett, we employ arts-based participatory qualitative and quantitative methodologies using co-design and co-production with children, young people and families and intergenerational groups. So by that, we try to dance on the margins of what is this blue line coming from outside the clinical culture and bringing something fresh, something new to complement the ways the healthcare system works. In the language that we use within NIHR, there is a guide, and the arts-based or arts-led and creative methodologies are proposed on the top 5 ways for inclusive involvement and engagement of participants. And I think this is really important. Although the arts is much more than just methodologies, but in the clinical world, we want to work with patients, families, healthcare professionals, play and life specialists, creative therapists, children, adolescents, and others who work on the margins of the system to create those opportunities for more inclusive participation, where they can speak their emotions, when they can talk about how they feel, to help them locate the pain, find a lexicon, a language to describe their physical or emotional pain, for a better understanding of children's worlds, which means better assessment of their pain and better treatment and recovery. My background is in applied theatre, and that means that my values are in role interaction, aesthetic distance, creativity, imagination, fiction, protection of emotions in fiction, site-specific performances, accessibility and inclusion. And in a magical way, all these values seem to be portable and transferable and can be applied in healthcare. To come and complement qualitative methods, quantitative methods, and other medical interventions. One of the challenges for us is to use the bedside space as a stage. This is a picture from Birmingham Children's Hospital. To use this space as a storytelling canvas. And why is this a challenge? It is because the physical space is a replica of children's emotional space. So when the artist comes from outside the healthcare system, which is very different from being a nurse or a medical working or consultant working in the hospital, we come as artists from outside the hospital. We want to be very careful, very gentle, and very ethical so that we don't invade children's worlds. We don't go too close to their emotions, but at the same time, we are close enough for them to create and co-create this fictional bubble and coexist within this bubble together, the child and the performer, for as long as this story lasts, for as long as the creative activity lasts. You can see the proximity here. The artist working with puppets with a child, so close. And the synergies between artists and children in hospital working bedside together are very strong, and they can bring wonderful moments of relaxation, a better understanding of their treatments by using alternative methods and artistic tools. Here you can see Rocket's Arts project, where we aimed to create a better emotional well-being and improve the engagement by using storytelling, participatory storytelling. You can see a space rocket made of a recycled barrel based on the concept of a doll's house. We used Playmobil toys. We had a story as a starter, and the storyteller gave a window of opportunity to each child to play with Playmobil toys and create their own stories. Here on this slide, you can see a publication. It's open access, so you're very welcome to have a look if you want. We also produced films that it was during COVID when we didn't have access to hospitals. This film is on YouTube. It's been used in this country across NHS hospitals, starting from Birmingham Children's and also in Australia and Queensland's Hospital and Sydney Hospital in palliative care. It's available on YouTube, and if we had more time, I would play it. It's only 7 minutes. If you have time, please lay back, turn the lights off, because there are some beautiful visuals, and watch this beautiful film. We produced other educational resources, such as the Simba, the Cocker Spaniel, and the dragon, using the dragon as a metaphor for fear and anxiety. And again, that was a film produced with funds from the lottery and from BBC Children in Need for children in hospitals. We had help from hospital teachers, especially during the time that we couldn't access children during the pandemic. So those films were downloaded on the hospital's iPads, and the children could watch them and write stories, develop stories inspired by the films. We offered them a collection of performers, drills, language activities based on the films to support the learning during their hospitalization and keep them in touch with hospital tuition, with the hope that they will go back to school. Here on the left side of the slide, you can see the performance that we used, where the children wrote their stories on one side, and on the other side there were checklists for the teachers for children for their observations to be recorded. The observations were about how the children participated in those activities. 10 of those stories are included in my book Applied Theatre in Pediatrics. And some of those stories were an inspiration to colleagues in Queensland, in Australia, who, with MA students, recreated those stories written by children at Birmingham Children's Hospital, and they performed them to an audience of children of the same age group who went in mainstream schools in Queensland. And there is a publication led by Dr. Lorenza, which is also open access and available. Another project in Australia where I'm involved as a visiting professor at the University of New South Wales in Sydney, it's called Future Stories. We use virtual reality. We build VR worlds together with young people in palliative care in 3 hospitals, 2 in Queensland and 1 in Sydney. And I'm honored that my research team are coming on the 11th of March at 9 o'clock in the morning for an hour to present the findings of this study. It's a free online event. You are very welcome to attend if you like. So what do we know a bit of learning from research I've been doing over the last 20-25 years about bedside theatre and the model that I introduced in pediatrics? It normalizes children's hospitalization experience. It improves communication with clinical staff. It distracts children from pain. It improves their moods, gives them a better sleep, especially if we perform in the afternoon. It gives them something to discuss with families, and also it improves cooperation with taking their medication. It engages children with hospital tuition and helps them with transition back to school. It offers children opportunities to communicate emotions to family and healthcare professionals for a further understanding of children's experience. It reframes a difficult experience in hospital from a new perspective, and it gives children the language of pain, a lexicon, more words to describe how they feel without the fear of judgment, without the fear of misunderstanding. That is the quality, the magic the beauty and the benefit of inviting children to participate in activities where they can feel they can be in role, pretending being somebody else, playing someone in a story. And within the fictional frame and the protection of their emotions, they open up and they talk about things they wouldn't talk otherwise. So we learn about their feelings and about their experiences firsthand. It's raw material, and we sometimes are surprised by the quality of the words and by the honesty of their sharing of their emotions. One of the articles I particularly like and love, it's very close to my heart, is one I published with Smileyscope from Oxford University. It's called The Lexicon of Pain, and it's open access, published by Creative Arts in Education and Therapy. I will close this presentation with the Glowing Stars study that happened within the Leeds Teaching Hospitals NHS Trust. It was an acceptability study where we asked children to self-report the levels of worry/anxiety and their understanding of what it's like to go for an MRI scan. We used Exploro digital app. It's an educational app. You can find it online. We had special codes given by Exploro CEO, and we're grateful for their help. And we tested children pre and post intervention. By intervention, I mean their interaction with the app. Everything happened on the day when they came to do their MRI scan, before their MRI. So I led the study. My co-investigators were amazing. Dr. Michael Loizu from the University of Plymouth, Professor Lucy Bray from Edge Hill University, and our own Dr. Mark Fabry from Leeds Beckett University. The industry partner was Exploro. We used before and after digital intervention, but the children who participated were from a big a range of from 4 to 11. Normally, these studies involve children from the age of 7 or 8 upwards. And younger children are not involved. They're not quite valued, I think. It's difficult to communicate with them, and maybe that's why. But my first degree is in early years education, and I have a deep love and affection and appreciation of what we can learn from younger children. So I wanted to involve them in this study. We used AEF for performance for children and for the parents, guardians. Performance for the child. We used a visual analog scale for the children to self-report their levels of anxiety before their MRI. With open and closed questions. There was space for drawing and doodling, which gave us qualitative data. The performance for the parent mirrored the questions with additional questions for demographics. And as a chief investigator, I was there myself observing the participation with the app and making notes on the days where the research took place. So we had both quantitative and qualitative data. And we came up with 3 themes. The first theme was about improved emotional safety and coping. We could see smiling and confidence after the interaction with the app, a shift from passive to active coping while waiting for their scan, better emotional regulation and autonomy supported by adults. Adults were myself, a research nurse, and the parent, if the parent was involved. Sometimes they were just watching. The second theme is creative expression and empowerment. The qualitative data, especially the drawings, showed shift from anxiety to calmness. They reflected positive emotional processing. The way children described their participation with words in their answers to open questions showed a supported empowerment, and they also moved towards some emotional self-regulation. And the third theme was improved procedural understanding of the MRI scan, which I think is particularly important. Not that emotions are not, the contrary, but some children receive the leaflet through the post about the procedure and what the MRI is about, but not all families sit down with the children to read them together. And so this information is not always as well communicated as we would hope. So we had children saying that the app helped them to understand the MRI and what was expected of them to do. For example, stay still like a statue. The majority of caregivers agreed to what the children reported about their understanding. Older children showed greater understanding of the MRI compared to younger children below the age of 6. And we also found that children could describe the MRI scan procedure step by step after their interaction with the app. So they knew better what to expect in the scan room after using the app. Here are some examples. So you can see two different children, a boy and a girl on the left and a boy on the right. The picture on the left is the one before playing with the app, and the picture next to it on the right is after playing with the app. Where you can see the terror on the face of that girl, not knowing what's going to happen, and then a different image. The same girl, color, green eyes, beautiful long hair with color, again, a smile. I'm cautious not to try to interpret exactly what the children might have felt when they made those drawings, but it's not rocket science that there is a shift. If we see the boy, you can't read it there, but on the one where the tongue is outside the mouth, which again shows a lot of tension, there are two words. One says worried and the other says excited. And after playing with the app, the word excited remained. So excitement can be a more positive or a less positive expression of emotion, but the word worried disappeared. And we can see that the boy painted himself as someone who's smiling and is ready to go and play football. So calmer and, you know, a picture that reminds normality here. So some key findings. The app improved understanding, especially for children above the age of 7. It supported emotional regulation. The app complemented existing coping strategies and adult support. Digital tools can support procedural readiness and positive hospital experiences, which is really important because we don't want children having traumatic experiences, especially when they need to go back for more and more MRI scans in case they have conditions such as cancer or epilepsy, and they have to attend a lot of MRIs. And also qualitative data that is different, especially the painting, the drawings, can offer insights to the emotional processing of the hospital experience. We collected the views of healthcare professionals who participated in the study, and they gave us very positive feedback, especially the last one. While Glowing Stars focuses specifically within radiology, its findings could have broader implications for improving pediatric healthcare experiences more widely. And that is very hopeful because the more we could use arts-based research using a mixture of methodologies, digital applications based on the values of participatory research and the ethics of participation, the more children we can support. Our publication is currently in print in the Journal of Enabling Technologies, and hopefully it will come out. And if anyone is interested, please do email me and I'm happy to share it. Where we are at the moment, and this is my last or one before the last slide, we are producing educational resources for children and families and the NHS staff. So currently, I work closely with the illustration team at Leeds Beckett University, and we are producing an A5 poster, physical and digital, with a guide about the preparation of children for MRIs, for both the parents and for the healthcare staff. I also wrote a story called Lolly and the Glowing Star, The main character is my Cocker Spaniel dog, Mocha, who you can see on the picture. And the aim is to create an illustrated storybook to prepare children for their MRI. And hopefully the children will be able to read it at home before they attend the hospital appointment. So I would like to produce a physical storybook, but also a digital version. And if possible, and if it is approved by NHS, stick the link to the letter for the children to be able to watch it and familiarize with the MRI process within the protection of fiction. We would also like to produce a short film. And of course, we are looking for funding. So if you have any ideas, please do share them with me, because it's all for the benefit of the children and hopefully the NHS system. Thank you very much for listening. I hope I'm within time.
You are. Thank you very much, Persephone.
I will now stop sharing.
Lovely. That's great. Thank you. Really, really insightful. And that leads in really nicely as well to our final speaker, because obviously Persephone talked about the importance of digital applications when it comes to things like this. And we've actually got Alex with us, who's from Smileyscope, who can chat to you in a little bit more detail about that. So Alex, over to you.
Hi everyone, my name's Alex. I am the clinical nurse specialist for Smileyscope over here in the UK and Ireland. If you can't tell from my accent, I am not from over here, as is Smileyscope. Smileyscope is a virtual reality technology that was developed in Australia, in Melbourne, by two clinicians. A little bit of background on me before I get started is that I am a pediatric emergency nurse and worked clinically with Smileyscope before coming over and being their clinical nurse specialist. So I'll just give you a really quick overview. It's not tons of time to give you the full run through of the device, but hopefully it teaches you a little bit more about what we are about and leads really nicely after Persephone's talk on the importance of digital media in healthcare. So Smileyscope was developed by two clinicians, a pediatrician, Evelyn, who found that so many of her pediatric patients were severely needle phobic, even if they'd never seen a needle done before, and Paul is an adult pulmonologist, and he was finding that needle phobia was extending far into patients' clinical journey and affecting those patients, particularly that were transferring from pediatric services into adult services where they don't have as much support, and there was an immediate drop-off in these patients getting the treatment that they needed because they were super anxious about seeking healthcare. So they decided to put their heads together to try and find something that could really help with that pain and anxiety around needle procedures in particular, but general procedural anxiety as well. And from the research that they found, virtual reality was the clear winner. We found in the research, if you can see on this slide, this is the same patient receiving the same pain stimuli with and without VR. And you can see immediately in the patient, the image of the patient receiving the pain stimuli with the VR, those pain centers in the brain immediately decrease. And this is because our brain has only so much bandwidth to be able to take on external stimuli. So as soon as you put them into an immersive world, that capacity to be able to take on the pain stimuli decreases, and they are able to remove themselves and have a more positive experience of what is going on. So Evelyn decided wanted to grab something straight off the shelf, but they couldn't find something that they could take straight into a healthcare environment that works within a clinical flow, mainly due to infection control concerns and also programs that are fit for purpose of across all age groups and be able to really capture different patient cohorts and their development. So they decided to create their own, as you do. And Evelyn sat down with 100 of her pediatric patients and asked them, if you could be anywhere else in the world other than this room, where would you like to be? And a lot of them said, well, at the beach, in the water, swimming with fish. And then she progressed the conversation and said, okay, well, what could the tourniquet be? And they said, okay, well, that could be our swimming floaties or our swimming band. And then what could the alcohol wipe be? Well, that could be the coolness of the water. And then, of course, the dreaded question of what could the needle poke be? And as you can imagine, some kids came back with some very colourful answers that couldn't be put on VR. But some did say, as I get into the water, sometimes the fish brush past me and they might even have a nibble. So that is where our therapy mode came from, completely from child imagination, which is really, really cool. What's a little bit different to traditional VR in that our therapy mode is not just a distraction mechanism. It was developed in a way to add choreography to the procedure and therefore reshape the way that these patients are experiencing a traumatic experience into something a lot more positive and look at it in a completely different way. So a little penguin called Poggles will take them on an underwater adventure, tells them they're putting on their swimming mask and that they're going diving. So they go under the water, they do some big bubble breathing with him, and then he starts telling them to have a look around. As he looks around, as they look around, I should say, they are able to catch the fish. So there's a little white dot on the screen, and as they catch the fish will make little dinging noises, and they will then swim up to the site that you've selected as your procedural site. Then the patients are able to look down at the procedural site you've selected and see the fish hovering and nibbling at where that site is. So it changes while this is all happening from a clinician's perspective, we are able to hear everything that comes out of the headset and able to know exactly what they're experiencing. Maintain that two-way communication with the patients, which is really important, and be able to then time our procedure to what they're experiencing in real time. In saying that, while it's got the choreography behind it, you don't need to follow it to a T to be able to get the same benefit. You very much just use it as a guide. So when I was using it clinically, I would be able to hear Poggles telling them that they are under the water, they're doing their breathing, they might feel the cold water, and I'd sort of be like, oh, okay, can you feel it now? And start cleaning the site and get them all ready to go through with the needle. A lot of the time, the patient will turn to you and say, oh, when is the needle happening? And you're far beyond it, all taped up, ready to go. And they're very much distracted by everything else that's going on that they don't even notice it's gone in. So from there, once it was developed, they put it through a big RCT through an emergency department and some phlebotomy clinics, and the results were amazing in terms of that reduction in pain, the reduction in anxiety, that caregiver-related distress was a big one that was reduced, and also that need for restraints, whether that's sedation or physical holding in these kids, which immediately shows you how much of a better experience it was. It meant that the procedural time was reduced, the procedural success was increased, and then that need for a longer stay wasn't required because they weren't having to have sedation medications. It was such a success that clinicians that were using it on the floor didn't want to give the device back after the study was completed. So from there, we really saw how much of a benefit it was across the board, and we decided to keep developing more programs with kids' input. So with patients' inputs, we have now over 50 programs. That needs to be updated. It's over 50 programs now on our device. Anything from our therapy mode, which is the choreographed procedure, to a breathe app where it does big bubble breathing with them underwater, really great for your inhalation medications or someone who is really prone to panic attacks. We then have our relax modes. These are a whole range of 3D videos accompanied with relaxing music, and some of my favorites. And that's anything from a room full of guide dog puppies, kittens, swimming with whale sharks. There's a Starry Night adventure. There's one at the Melbourne Zoo at the butterfly enclosure and the giant tortoise enclosure, a safari in Kenya, sitting at the beach, sitting by the river, and then for those that are that way inclined, there is a roller coaster and a snowboarding adventure and a motocross riding one. And these are all as interactive as you want them to be. So they're all 360, they're all filmed on a 360 camera, and the child is able to fully look around and see what's going on around them, but also are able to sit still and stay relaxed while things are going on. We then have our mindfulness app. So these are guided meditations, really great for your adolescent cohort. One in particular is led by Sir David Attenborough that everyone loves, and really great for your mental health patients too, to give them a space to feel safe and feel empowered to conquer their healthcare journey. Then we have some mini games and a magic show, really great for distraction, and which leads very nicely into Persephone's project on glowing stars, is our MRI and CT familiarization tool. So as an addition to glowing stars, I was thinking while Persephone was talking, it is a graded experience of an MRI and CT machine where they're able to walk through into the radiology room, have a chat to someone about what they might expect in terms of taking off their jewelry, putting on a gown, fasting, and then they're walked into the radiology room, shown the MRI and CT machines, and then they lie down on the bed. The coil will come over their heads and make all the weird and wonderful noises while they are wearing the headset, and the sounds are very, very realistic, and they're able to also look completely around themselves. So it's all 360. They're able to look out of the machine, see their feet. So it's very much able to capture what it's going to be like in that machine without getting into the actual radiology room. We then gamified it with two different experiences. One is a bakery experience where they catch donuts on their heads, and the other is a space experience where space portals open up and animals dressed in spacesuits jump through. And this is a nice way to show them how still they actually will have to keep their heads in the machines during the whole period of time, but changing the way that they think about it and making it a bit more fun. So it's not just keep nice and still, no, don't move, and then at the end they get a star rating for how well they've done. And the results on that has been amazing. We've seen a 90% reduction in the need for general anesthetic with preparing the patients to be able to take on the MRI machine and empower them to feel that, oh, yep, okay, I know what to expect, and I know what I'm going into, rather than freaking out once they get into the machine. In terms of setup and how it all works, very, very quickly. So the headset itself is just at the bottom here. So it is a headset and then a faceplate. The faceplate is removed by 4 magnets that click it into place onto the front. The whole machine itself it doesn't need Wi-Fi, it doesn't need Bluetooth, it's as it comes, all preloaded with your all the different modules, and the sound comes out of the headset, so you don't need any external parts or headphones or anything like that. In terms of its setup, there's only 4 little steps to it. So setting up the machine itself is once you turn it on, you select what you'd like, and it's very intuitive clicking through. So select your program, click through next, decide on what sort of alternative options you'd like in terms of age group, time, length, volume. We have 12 different language options on our therapy mode, and then you adjust. Once you have selected with the patient what they'd like to see, you then just click next again, and it will come up with that 3rd screen, that calibration screen. This is just when the headset is working out what way the patient is facing, and I guess is the only technical part of the setup, as this is the part you just need to make sure that the faceplate gets clicked into place onto the headset with those magnets and then put back onto the patient, that the patient is nice and comfortable in whatever position you need them to be in, and they can be lying down, lying on their side, sitting up, and all you have to do is click that little green button on the top 3 times and it will start automatically. That's a very, very quick overview of how to set it up. In terms of where it's used across the hospital, we're really seeing it being very successfully used across all departments, and being able to really follow the patient's journey through the whole hospital, which adds to that standard of care, that continuation of care, and really able to make sure the patients feel they can get through different aspects of their care at all stages. And, you know, that's from when they first enter the emergency room, through to theatre, through to their outpatient appointments, and empower them to be able to take on all the different stresses that come with the hospital. That is a very quick overview. If anyone is keen on learning more, or would like to try it at your different sites, definitely take down my details. We have a whole range of research that has been done with the Smileyscope, and I can give lots of education to your teams and be able to support you with a trial of the device as well within your services at no cost. So please get in touch if you're interested. It's being used a lot over the UK, Australia, and the US now, which is really exciting. And thank you so much to the Innovation Hub for having me too.
Perfect. Thank you so much, Alex. That was really insightful. And I think one thing just to mention that obviously Smileyscope is a company based at the Innovation Pop-Up as well. So if you do need any demo days, I know, Alex, you're more than happy to come up, and we do demo days and things like this here with different companies. So please do get in touch either with us or with Alex as well. So we have got 8 minutes left before we close, and I do, you know, I want to close on time because I appreciate it's the end of the day and people have trains and things to catch. But any questions for either Steph, Persephone, or Alex before we start to wrap up? Chris, I can see a hand in the room.
Hi there. This is a question for Persephone. Thank you so much for your presentation. It's just a question. Have you had any funding from the Leeds Children's Hospitals or any of the NHS bodies that you've worked with so far in terms of kind of commissioning this work?
No.
Do you think that will change at any point?
Yes, hopefully in the future. It seems that there are opportunities, especially within the charity. So I'm keen to explore.
Okay, thank you.
Thank you.
Thank you, Chris. Any more questions? We've got Richard, hand in the room.
Yeah, just to come in with a follow-up, I think, to Chris's question there, and commentary as well from Persephone. Persephone, I know I've just reached out following the call with a few opportunities coming up for innovation project funding, and Chris is very right to flag the Leeds Hospital charity is do a lot within Leeds Teaching Hospitals Trust to support innovation. I think we might even have charity colleagues on the call today, so I'll be very happy to make some introductions and see what might be possible in the future. Persephone, too, as well, actually your areas of work were flagged up in a recent opportunity we had through the NHS Insights programme, and Chris likewise working at Chelsea and Westminster. We are seeing some opportunities coming through for some of those NHS organisations involved in that Insights programme, and I'm led to believe there is one coming up. So it might be another route or opportunity to explore for funding or commissioning, particularly some of the activity that you reflected. But likewise as well, the charity has supported previously calls around VR and introduction of VR technology across the hospitals too, where obviously Smileyscope actually came to us from Chelsea and Westminster, the work that you were doing over there. So yeah, very happy to keep in touch with yourselves and others on the call to see what we might realise on that front. Thank you.
Thank you so much, Richard and Chris. It means a lot. For us, being artists and coming from outside the NHS, we definitely need great advocates and people from within the system to alert us when there are opportunities. I'm in discussions with Becky Valderobus from the charity, who is wonderful, and she, I think she's already in love with my story. So hopefully there will be an opportunity to get the funds that we need. So yes, please, I'm open. Feel free to email me. And if there is something that I might be able to contribute towards your activities or your workshops or any training for your staff with regards to the work that I do, I would be very happy to do so.
Perfect. Thank you, Persephone. And I know obviously you're in touch with our comms team as well and trying to highlight some of the great work you've done with regards to the Glowing Stars study. So yeah, great to see that those collaborations are already starting, which is fabulous. 4 minutes left. Any final questions before I wrap up? No, okie dokie. So I'll just want to say a big, massive thank you to our 3 speakers today. I really appreciate you taking the time to come and present today. Great to have you on board and really fascinating presentations. You'll see in the chats that we've just posted a couple of links. The first one is a feedback form, so we'd appreciate any feedback with regards to today's session, and it will also help us shape future sessions as well, and can really shape those too. And the second link is also for you to sign up to our innovation mailing list. So this is where all the activity to do as part of the innovation pop-up. You will be notified whether it's the innovation clubs, educational sessions that we run, or networking opportunities. We'd love for you to sign up just so you can keep an eye on all the activity we do. But with that, I will draw to a close. Thank you very much to everyone that attended today. Appreciate you taking the time to join. Hope you found it useful, and safe travels home, everyone. Thank you.
Thanks, Rachel.
Thank you. Bye-bye. Bye.
Thank you for organising it. Thank you.
You're very welcome.
Thank you, Rachel. Thanks for having us.
Thank you, Steph and Alex. Amazing work. I would love to know more.
Yes, me too. On all fronts, please.
Let's keep in touch.
Absolutely, that would be great.
Absolutely.
Have a coffee in Leeds, maybe.
Oh.
Yes, definitely.
Cafe Nero is my second home.
Oh, is it? I'm in there sometimes on a Thursday morning, so if I see you, I'll wave. I'll come over and say hi.
Because it's right next to the Leeds School of Arts.
Oh yeah, it is, isn't it? On the thing, I'll be driving past you in a second on my way out.
Okay. Wave me.
I will. I'll wave on my way by.
Okay,
Thanks ever so much.
Thank you so much,
everyone.
Thank you. Bye.
Bye. Bye. Bye.